Welcome back to Talk 1260, KTRC. This is Dr. Daniel Ronel. You're listening to the Humanity Behind the Vanity. I'm here with my wife, Betsy Ronel. We just heard from Mark Wood, our nutritional tip. And now I wanted to talk more about the issue of doing multiple procedures. And I wanted to make more of a medical discussion. And, you know, really, what does it mean to combine these procedures? Many people want to do this because they save money, they save downtime, they're getting it all done at the same time, so the recovery time encompasses recovering from multiple procedures. And I think that's great. I think that's a great idea. In truth, you should know that when you combine procedures, the risk of each procedure goes up a little bit, and there is a limit. In a young, healthy person, they can stay in the operating room for 5, 6, 7 hours and get a lot of procedures done. Perhaps in an older person, somebody with a medical condition or somebody who smokes, that's not a good idea. A lot of the procedures that were popularized in this article on Heidi Montag, a lot of those procedures are small office procedures, and they don't really add to the risk of having any problems in the operating room. In truth, if you're under general anesthesia for 3 hours or 5 hours, it doesn't make a big difference. If you're there for a couple hours anyway, it really doesn't make a difference. So I like to combine procedures also. I like to do what I think people can recover from. For example, today I saw a lady who wants a tummy tuck and an arm tuck, and that's acceptable to me. That's fine. I think combining a facelift and a tummy tuck, that would be a little much. That's major. Yeah. That would be a little much, because who's getting a facelift? It's not a 25-year-old.
Right.
And
it's just also major.
Yeah, it's a lot of surgery. And for example, combining to do a body lift, which is a great procedure that I like to do, and we've talked about this before. You really have to. A body lift is a combination of a tummy tuck and a buttock lift and a thigh lift.
That's major.
That's major. You need to be young and healthy, and you're going to be in a lot of pain for a couple of days afterwards.
You don't still have to be young, but you have to be in good shape,
yes, because
it's a big recovery.
That's true. You don't have to be young.
Right.
So those are some of the issues involved with combining procedures.
Let's talk about hers, what she did, because she did something I don't think is that common, but I know it's done because I know people who had it done. What about the chin reduction?
I don't know much about that because I don't do orthognathic surgery. That's craniofacial surgery. I was trained in that, and then I decided not to go down that route because you really should do a fellowship in that. What it is basically is you open up the inside of the lip and you expose the chin and you chip it down.
Kind of like a nose job?
Kind of like a nose job, but the chin is a big piece of bone, and so
it's connected to your jaw.
Yeah, and I don't know what she had done. A lot of people have chin advancement surgery.
She said that when she smiled, she was like Jay Leno, so she had her, the tip of her chin
chipped down,
taken down, right?
And many plastic surgeons who do a lot of head and neck craniofacial surgeries are comfortable doing that.
Right.
Most plastic surgeons who are doing, breast, body, facelifts, they would refer that procedure to somebody else. And typically, what we've seen on these reality shows is people like VIPs who get multiple procedures also have multiple surgeons. It may not be just the one surgeon who's doing everything.
Right, he's the one who was given the credit, so who knows?
So, who knows what happened there.
So, and then let's go over the other ones. Then she had neck lipo, which you do, but you say it's really not as simple as one would think it is.
Yeah, neck liposuction, again, in a young, healthy person, it can be a very quick and simple procedure.
What about a normal age person, someone who's in their late 30s to early 40s?
It's really not a dangerous procedure.
No,
it's all right. If it's done correctly, it's all superficial. Of course, there are a lot of important structures in the neck. Right. And so you want to go to somebody who's reputable, who's done it before. And it's not, the recovery time is actually only a few days. You can be pretty stiff and sore during that time, but usually the recovery time is just a few days. And most people who do neck liposuction also combine it with doing other things.
Right, so she probably combined it with the chin reduction.
Right.
Which would make sense.
Yeah, I've done it a lot with people who have a rhinoplasty, a nose job.
A facelift, obviously.
Right, every facelift I do has neck liposuction. It's part of my facelift technique, which we've talked about before. is I always do neck liposuction when I do a facelift, and that's a very easy combination.
Awesome.
I wouldn't even call that multiple procedures. I would call that the modern facelift, which is not, you know, with an additional procedure of neck liposuction.
Because you're already in there.
Right, you're already in there. The lower eyelid tuck is part of the modern facelift. I don't consider that an extra procedure.
Right, okay, so then she had inner outer thigh lipo and then the butt aug.
Right, and you know, we can talk about butt augs because there's a lot of different ways to do it, some of which have much higher risks than others. And so since I don't know what
you
she
do
had
not do
done,
them. But you do not do them.
I don't do buttock implants, but I'm thinking about getting back into it because there are new techniques and new implants that are out there. So every few years, I like to review the literature about things and see whether they're acceptable. In the past, buttock augmentations had a high complication rate, almost 20%, which I think is too high.
That's high.
And it's 1 out of 5 people.
Right.
But I just recently have read a report that they are doing them with lower complication rates, so I'm going to look into that. I'd like to be able to offer that procedure because there are people who really have
you could use one. You have a tiny behind.
Well, there you go.
Yeah.
There's a lot of people who ask me for that, and I refer them to Carlos Mendieta in Florida because he's really the master. But I think I might be getting back into that. Stay tuned.
Yeah. So, okay. So in the inner outer thigh, that speaks for itself.
Yeah.
It's no big deal. Do people inject fat into their own behind to augment it that way?
Yeah, that's the Brazilian butt lift.
Right.
That's what that is people who have liposuction and that fat is injected into the buttocks. And it's a great idea. About 50% of the transferred fat cells are dead in 8 months. And so the results are not long lasting. Having said that, there are some masters who, I don't know how they do it, they have special techniques, but they have longer lasting results. Like I said, like Carlos Mendieta in Florida, and there are some people in Brazil and South America, obviously, who are true masters. But typically the Brazilian butt lift does not last very long.
Okay.
And that's why buttock augmentation would be a better thing if we can find a way to do it that really has a lower complication rate than what has traditionally been out there.
Interesting. All right. Well, do you have anything else to say on this combination of procedures, calming down the public that this was not 10 procedures?
Yeah, I think that was a bit of a media hype, just to get people like us to read those articles.
But we're here to normalize it. It was not 10 procedures. It was a couple of procedures with a couple of extra things thrown in while they were already in that area.
No, if you have any more questions about this topic or anything else, just go to the website and email me, danielronelmd.com. The contact us goes right to me. We also have a blog. We're on Facebook. We have a Facebook fan page, and a lot of these things I talk about, I can write about them more at length.
You're on Twitter?
I'm on Twitter also.
What's the other one? Oh, our YouTube. No.
Oh, yeah, our
YouTube. Sorry,
yes,
I thought there was another media outlet.
So please go to the website, danielronelmd.com. We just have a brand new website
yeah.
Studio X, a local web designer made. They are fantastic.
It's a great looking website.
I highly recommend them. And we've got to wrap things up. So thanks again for listening. I want to thank our sponsors, Suniva Medical, the makers of Artifil, and iFlow, the makers of the Pain Buster Pain Pump.
And tune in next week at our new time, which is 12:30 every Saturday right here on KTRC.